President Biden is not done yet. He just proposed a new rule to have Medicare and Medicaid cover weight loss drugs like Ozempic and Wegovy starting in 2026. Now, hang on there, partner. This may never actually become a thing, and I'm going to tell you why in a second. But first, the White House released this proposed rule this morning from the Health and Human Services Department. The White House says tens of millions of Americans, about 42%, struggle with obesity, and the Biden administration considers obesity a chronic disease that increases your risks of developing other comorbidities like diabetes, heart disease, stroke, and some cancers. The White House says by covering these GLP-1 medications on the front end, those comorbidities may never develop in the first place, so it would save the government from paying for even more expensive treatments on the back end. Of course, these medications are already covered by Medicare and Medicaid, but only to treat conditions like diabetes. This new proposal would change the rule and would expand the access and allow them to be prescribed and covered to treat obesity too. That means it would only be covered if a doctor determines a person has a body mass index of 30 or higher. Now, most of you already know these GLP-1 medications are super expensive, sometimes costing $1,000 a month. So if this new proposal goes forward for Medicare enrollees, it could bring down the out-of-pocket costs by as much as 95%, and those on Medicaid would get access to this too. And if they're covered by Medicare and Medicaid, it increases the chances of them ultimately being covered by your health insurance to treat obesity too. Now, a couple of things here. One, there is a decades-old law called the Social Security Act that says Medicare and Medicaid cannot cover drugs specifically for weight loss. But under this proposed rule, the Biden administration is saying it's not about weight loss. Obesity is a disease, and medications that treat it should be covered like other medications used to treat other diseases. We'll see if that justification flies. And the other more important part of all of this proposal needs to go through the lengthy regulatory process, which means it will stretch into the Trump administration. So it will be up to the Trump team to determine whether or not to follow through with it. Plus, it's worth noting that RFK Jr., who is Trump's pick to lead Health and Human Services, is not a fan of these types of GLP-1 medications. And he said publicly several times the government should not be covering these types of drugs and instead should be supporting broad expansion of coverage for healthier foods and gym memberships. So if you want to read this new proposed rule for yourself, I will email it out to you tonight in my News Girl News Roundup email, so make sure you sign yourself up.